Presentation. There we go. I'm trying to share the presentation. I'm not sure what's going on here. I apologize for that. There we go. So as I mentioned, we're going to talk about GLP, GLP-1, and GIP agonists. These are medications that work similar to the hormones that our body produces naturally. Some of us may have a deficiency in this or just a disruption in the way that they work, and that can affect many aspects of our health. We're going to discuss the uses, what's FDA approved for the use of these medications, the safety, and the precautions necessary to follow when using this medication. So the way that or the areas that these medications help or affect uh, are several. All over the body, we have learned that these medications can benefit multiple parts of our body, from musculoskeletal areas, including or the use of insulin and sugar or glucose in the muscle, to heart health, the way that our stomach and the entire gut works, the fatty tissue, kidneys, even the lungs have been associated with good and promising results long term. Brain, things like neurodegenerative diseases like Alzheimer's, Parkinson's disease. There's a lot of the in the pipeline. We're learning more and more as time goes by about these medications. So these hormones, what do they do? So they act basically like the hormones, as I mentioned before, that our body produces. One of the main mechanism of action is the production of insulin. It helps us if the insulin that we're producing is not optimal, it doesn't act the way it's supposed to, it's bad quality, or if we're not producing enough, these medications would have that effect through stimulating the pancreas directly. It also slows the stomach emptying, therefore, we stay full longer. Um, that promotes good satiety, and we have a tendency to eat less when we have these medications working the way it's supposed to. The other benefit or the other effect on a stomach emptying is going to be that it may improve cravings. The satiety is so good that sometimes people will not have any of these cravings for different things, mainly carbohydrates. Um, it also, the GIP is the other type. So we have two main medications currently. One is Ozempic. Most of us have heard about Ozempic. Wegovy is the one that FDA approved for weight loss, and then the GLP-1 GIP is going to be Zepbound and Mounjaro. Those two medications are FDA approved for weight loss and diabetes treatment, respectively. These are the approvals, and
Oh, yes, I saw
we're
the picture.
subject to FDA approval and indications for different diagnoses and conditions when using and prescribing this medication. Of course, type 2 diabetes. This is the type of diabetes where our body does not produce enough insulin, or the insulin quality is not very good. Of course, obesity. So the medications that I mentioned before are FDA approved for the treatment of obesity or weight management. One that we don't hear a lot about is Saxenda. It's been around for a long time, and is one of those medications that we forget because uh, the Zepbound, the Mounjaro, and the Ozempics have been made very popular with in social media. The other one is heart disease. If the person has known heart disease, chronic or congestive heart failure, a history of heart attacks, these medications are approved and indicated in the use of for the use of treatment or reduction of risk of more or other heart complications long term. Now, there has to be a combination of symptoms or diagnosis with this. So it would be obesity or a high BMI with known history of heart disease or, of course, diabetes. As I mentioned, there's a lot in the pipeline under investigation. We have fatty liver, neurodegenerative degenerative disorders like Alzheimer's and Parkinson's disease. Anti-aging medicine is doing a lot of studying on the use of these medications as well. Addiction, it has shown that the
Don't show.
medication can decrease the cravings for alcohol, nicotine, and even um, I'm sorry, and even drugs. Eating disorders is going to be a big one as well, particularly things like bulimia and anorexia. Can you all confirm that you can see the presentation, the slides? Anyone in the audience
It's stuck on the first slide.
stuck on the first slide? Okay. So I'm trying to change it right now. Apologize for that. Is it changing now?
No.
No. I'm sorry about that. Let me double check.
Let me share my screen and get your slides up one side. Can everybody see that?
Yes.
Okay. Dr. Torres, do you want me to go back?
I cannot see it on my end. Let me try to share my.
Huh? You should, because it has to do with that sending the tide and all that stuff. It's about those shots. Just,
Okay, can you please go to the fourth slide?
I love you.
So this is what I was talking about with the indication and FDA approval, and this is important because off-label use at this time is not recommended, and this is subject to insurance covering these medications as well. Next slide, please. Then, so what are the limitations for use? What are the precautions or contraindications for the use of the medication? So, a big one, this is what the FDA calls a black box warning. It's going to be a personal or family history of thyroid cancer. There's a specific type of cancer. Even though we haven't seen any of these reports that have been directly associated with the medication in humans, the FDA did require this to be uh, added to their product insert as a black box warning due to seeing this in animal studies. A history of pancreatitis. This is an inflammation of your pancreas. If you've had this for any reason in the past, whether it is stones or biliary stones or gallbladder stones, even alcohol or no reason. Sometimes we don't know why people develop pancreatitis, but most of the time you can point it to a medication, diabetes, etc. That would preclude patients from using this medication, as the medication can trigger an inflammation of the pancreas. Um, Diseases of the stomach and the intestine. Gastroparesis is a big one. Gastroparesis is a condition where your body loses the ability of moving the stomach the way it's supposed to. Therefore, the digestion is not uh, very efficacious, and using this medication is going to slow things down even more. So that can lead to a lot of nausea, vomiting, malnutrition, etc. Gallbladder problems, chronic constipation. This medication is gonna. These medications can make those problems worse. Therefore, the use of these are not recommended. Age-associated conditions, so malnutrition is going to be a big one. Bone disorders like osteopenia or osteoporosis. These are conditions that increase as we age, usually after age 50, 60, depending on our activity and our diet. These medications, since people eat less, they can affect nutrition and they can affect bone health as well. And of course, pregnancy and lactation, there's no good studies right now, and it is considered that may cause fetal harm, so it's not recommended for the use even in diabetics during pregnancy. Next slide, please. Other limitations will include kidney problems. We have to monitor that the patient is staying hydrated. If you're full all the time, you may have a tendency to drink less water. So we have to find that balance where the person is drinking enough water and eating enough food to prevent malnutrition as well. Dehydration can lead to kidney problems, particularly kidney failure. We have to be very cautious about this. In adolescents, at this time, liraglutide, which is Trulicity, and semaglutide, which is Wegovy and Ozempic, are the ones that are recommended. It may affect also fertility. It can actually increase fertility or affect the way that oral contraceptives or birth control pills work. So we may recommend the use of condoms in addition to the birth control pills to prevent pregnancy. Mental health, these medications particularly have been associated with an increased risk of depression. If the person is not exercising enough and following, even though they're eating less, following a healthy diet, less carbohydrates, less sugar, that can lead to a decline in their mental health as well. It's very important to use it with caution in patients that have had a history of suicidal attempts or suicidal ideation. These medications can, we don't understand why, but they can increase the risk of these thoughts. And of course, the limitation is cost. At this time, the medications are very expensive, and insurance coverage can be limited if it's outside of the FDA um, approvals, and depending on how their formulary is set up as well. So next slide, please. So of course, like many other medicines, you're gonna see you see the commercials and all the long list of side effects. So there are gonna be common side effects and serious side effects associated with this medication. Next slide, please. The most common ones are going to be nausea with or without vomiting. This can lead to dehydration. If you're vomiting a lot, again, malnutrition. So we have to be very careful. If the person cannot tolerate it, this is going to be a big limitation. Won't be able to use it. uh, Constipation is a lot more common with either one of these medicines, but diarrhea can also happen. gastroesophageal reflux disease, so you may have more heartburn or sour stomach, that sort of thing, and that's because of the delay of the emptying of the stomach. Fatigue, you're eating less, probably drinking less water as well. That may lead to that. So your doctor has to monitor these side effects very closely to either adjust or sometimes even stop the medicine. Sensitivity reactions, so allergic reactions either at the site of injection. So these medications, as you all know, are injected medicines once a week. There is an oral form of semaglutide, but at this time is approved for diabetes only. Rashes have been described as well, and anaphylactic reactions where you can have a sensation of your throat closing. That can be something that we can see as well. It's rare, but um, it's more common to have some sort of skin sensitivity. Hair loss as well, again associated with the malnutrition, and muscle loss. This is a very important one because if the person is not eating enough protein and not exercising, they're going to have a lot of muscle loss. This can affect mobility long term. Lack of muscle decreases life expectancy. So it's not really a good thing to lose all this weight at the expense of muscle loss, and then it's going to reduce your life expectancy anyway. Next slide, please. Then more serious effects, side effects. So pancreatitis, that's a big one. Again, an acute that is potentially life-threatening. Chronic, also dangerous, and carries a lot of side effects overall, or symptoms, I should say. Pain, chronic pain at the level of the stomach, generally on the left side or the middle, nausea, vomiting, indigestion. All of these things can happen during pancreatitis, and again, it can be a life-threatening condition. Gastroparesis, that it can be long. You may even stop the medications, and you may continue to have the problem that you're not digesting the food even months after stopping it. And there are a few reported cases of permanent gastroparesis, which is terrible because people cannot absorb the nutrients, they can barely eat, and they're constantly vomiting. Although there's treatment for that, there are some devices, implants, medications that can be used for this. It's not optimal to develop that. Gallbladder disease, if we lose weight too rapidly, that can lead to gallbladder stones, or insufficiency means it can affect the way that the gallbladder acts. Gallbladder produces bile, which helps with the digestion of fat, and that may be affected. If that happens, you may have a lot of diarrhea, even explosive, uncontrolled diarrhea, having accidents. So that's an indication to stop it. An acute kidney injury, again, from dehydration, as mentioned before. And another severe one is intestinal obstruction. You get so constipated that the stool is not being evacuated, and that can lead to a perforation of the intestine. Very dangerous. Next slide, please. Um, Now, less frequent is going to be low blood sugar. That's in patients with diabetes that are using either insulin or other medications like glipizide or glimepiride, common medicines that we use for diabetes. So the prescriber has to be careful and educate the patients about what to do, how to modify these medications before starting the GLP hormone. Malnutrition, frailty. You lose a lot of muscle, you're going to be frail, you're going to be weak. You may have loss of balance, increased risk for falls, particularly in patients that are older, and of course, long term osteoporosis. The bones may get weak, and people may experience fractures with lower impact or small trauma. And the big one, the medullary thyroid carcinoma, again, black box warning from the FDA. I'm not aware of any reports of these complications in humans. We saw that in mice models, but again, it's something that we need to pay attention because it was unusually high in those models. Visual problems: if you have diabetes and already have eye-related complications, it may get it worse and even lead to vision loss. So, in summary, it's an effective medication that we use for diabetes for the treatment of obesity, weight management, and cardiovascular protection in patients that have had known heart attacks or congestive heart failure. We tell our doctors to use it with caution. Unfortunately, there's a lot of off-label use out there, and we have to stay with the use of that the FDA has provided us approval with. Gastrointestinal effects. Remember, if you were to start this medication, it's going to be important to communicate. Most of them, even though common, they're very manageable, and generally they subside or go away after a couple of weeks of using the medicine. Um, the serious risks are rare, but it's very important to discuss with your prescriber to be aware. Those attending this talk today will know about them, but it's very important to communicate. You know, if your family member is going to have those, it's very important to screen for any of the potential risks or past history because these medications can cause significant problems. And again, education, you know, leads to success. Staying engaged, talking to your doctor about this, the use of the medications, the side effects, what to expect from it, is going to be very important. Generally, with this GLP generally, they talk about between 5 to 20% of the baseline weight. So if someone is 200 pounds, they may see, up to 40 pounds of weight loss in the time frame of usually 6 months to a year. And the last slide, I'm open for questions. I can start with some questions that were sent to me in advance, and then we can proceed with questions from the audience. So the first question was if the only condition or quote unquote symptom I have is a BMI of 37.8. I'm postmenopausal, on hormone therapy and taking antidepressants, anxiety medications, which all contribute to the inability to lose weight. So it's going to be dependent on the insurance guidelines. With that BMI, the patient has an indication to use these medications. The limitation is going to be insurance coverage. Unfortunately, we can complete prior authorizations, we appeal them, and they're still denied sometimes. But in this particular case, based on the diagnosis of the BMI, the medication could be covered. It is indicated. The other conditions mentioned do not really have an impact in the approval. Of course, they may affect the ability of some people to lose weight, but it's not going to increase the likelihood of being approved by the insurance. The next question is the GLP, or it's kind of a comment. GLPs have reportedly improved inflammatory symptoms for individuals with myalgic encephalomyelitis or chronic fatigue syndrome. Have the researchers or practitioners identified a proposed mechanism for these inflammatory benefits? Since ME is, the right cause or the exact cause of ME is unknown at this time, other than the anti-inflammatory effect of these medications, we don't have a good idea of why uh, these medications may help with that. I haven't seen a lot of robust um, research on the use of GLPs in this condition or chronic fatigue syndrome. We have isolated studies, so at this point, it's not good enough evidence to start recommending it, as this is a very complex condition. There are multiple factors that can affect it, uh, and the diagnosis is completely clinical. We don't have a test that confirms it. Usually, after you're done several testing and lab work and seeing different doctors, it's like the last diagnosis that we give patients. So then why won't our insurance approve it? I'm being prescribed different or several different GLPs, but insurance denied it. So that is really going to depend on their guidelines. Unfortunately, it's not something that as doctors have a lot of control over. Plan designs as well from employers may depend on that. Um, um, so it's we always send the medication. If it's denied, we get a prior authorization. If it's denied again, generally we appeal it. We complete the information with what we have. Of course, we cannot add information that is not accurate, and in those cases we're really up it's really up to the insurance. Question 4: any chance that GLP medications are approved for immune related illnesses or chronic inflammation? So more studies are needed. Specifically, what type of inflammation is it going to be for arthritis, for example, or just the general inflammation that can happen in conditions like heart disease or history of strokes and things like that. So more to come on that. Once the studies are more robust and they can present this to the FDA for approval, we'll know more about that. And does Aetna cover GLP drugs like plan on each plan, and depending on how the plan has been designed for the employer? I'm open to questions now.
We have one in the chat box. It's from El Chapa. Why is it so dangerous for type 1 diabetics?
So in the case of the type 1 diabetics, they have more complications like gastroparesis that I mentioned during the presentation. They are more likely to develop that. Also, the medication is not going to be effective because they don't have pancreatic activity anymore. The pancreas is not producing any insulin, and there are inflammatory precursors and antibodies in the blood that destroy the person's insulin. Therefore, it's not indicated because it's really not going to work. And the risk of side effects and complications is a lot higher in patients with type 1 diabetes. I have the chat open now. I can see the questions.
If anyone has any questions, you can go ahead and unmute yourself as well.
Okay, so if there are no other questions for me, I appreciate attending our presentation today. Um, the recording is going to be available, and it's been a pleasure for me. And um, please continue to take care of yourself. There's a lot of interest in these medications, and talk to your doctors for potential prescription and management of your conditions. Thank you very much, and you all have a great weekend.
Thank you, doctor.